a little bit different. And a pre-certification is a certification for services that you get prior to beginning a specific service. Most times, a lot of insurance companies will not backdate a certification, so it is important that you obtain that prior to starting your service. Now we just have a little question screen here.
I'm going to put up the poll for your experience in using insurance. So just let us know what your comfort level is. If you have been billing insurance before, or if you don't necessarily bill insurance, but maybe you get a lot of questions about it. And just kind of let us know kind of what your comfort level is here. So we'll give folks a few chances to respond. Waiting on a few more responses. We got about 78% of you have voted. So I'd like to hit 80. So if you haven't voted yet, just let us, if you would be so kind, is to go ahead and vote. All right, I'm going to go ahead and end the poll. And so, Destiny, it looks like, wow, very few people are like full on comfortable with billing insurance. But there's a lot of questions about that. So actually, I'm surprised.
Yeah, I'm not sure that I'd even put myself in very comfortable.
Well, I guess so. I guess that's true.
But yeah, it's kind of nice. Got a decent amount right there in the middle. And I am here to answer the question, so this is working out perfectly. Okay, let's see, provider responsibilities. Okay, so the responsibilities of the provider prior to starting services. You are required to contact the insurance company to verify the benefits of all of your families prior to starting your services, as well as verifying that insurance coverage has not changed. When you go to see the family, it's a good idea to make a call at the beginning of each new benefit year, because that is when it's likely that something with the plan is going to change, if there are going to be changes. Even if the plan itself has not changed, if there's not a new ID number, new group number, there could still be provisions in the plan that have changed that the patient may not be aware of. So it's always a good idea to make a benefit call at the beginning of a new benefit year, just to make sure that nothing has changed, make sure no pre-cert requirements have changed. That is what we do here at the CBO, is make a new call at the beginning of a benefit year. So we suggest that the providers do that also, just to make sure that you're covered. If there is changes to insurance or new insurance, you need to update the CFC, let that service coordinator know, so they can request a new benefit verification here with the CBO, so we can get that call made. You have to follow the rules and guidelines of the insurance company, as far as if you are an out-of-network provider and if they don't have out-of-network benefits, you shouldn't be seeing that child. You should refer it back to the CFC. If it requires pre-certification, you have to obtain pre-certification. So that's what I mean by following the rules and guidelines. Make sure you're following up with the insurance company, submitting any requested documentation such as evaluations, script, office notes, anything that they're requesting to be able to process a claim that has been submitted. Make sure your associate level providers are licensed and credentials, and that the credential is active, because we do check that here on the CBO side. Make sure that you are billing the insurance company and the CBO appropriately and in a timely manner. CBO timely filing is 90 days from the date of service. If you do not have to bill it to insurance, otherwise it is 90 days from the processing date on the EOB to be timely to bill the CBO. Timely filing with insurance companies varies. Some plans, it can be as soon as 30 or 60 days. Some plans, it's as long as 365 days. So there's not a set time for timely filing with insurance companies, and each plan is different. And that's not to say that, you know, Blue Cross is a year. That means every plan within Blue Cross has different timely filing requirements. So your best bet is to bill your claims as soon as you can so you don't run into timely filing requirements. And then when you get that EOB, bill it to CBO as soon as you can. So again, you're not running into those timely filing requirements.
Destiny, can you go back
Yeah.
a slide for just a moment?
Yeah.
Yeah, go
Yeah.
back. Yeah, one more. Yeah.
One more. Gotcha.
Yeah. So, so for providers, what I understanding that you're saying is that with every family that has insurance, they need to verify insurance for every single family, whether because everyone's insurance is different. Blue Cross is not the same for this family versus that family. Is that correct?
Mm-hmm. Right.
Okay. And then, and so how often should they verify the insurance benefits?
They should call the insurance company when they start seeing the family.
Mm-hmm.
And then they should be just checking with the family through, you know, when they go see them, hey, has anything changed with your insurance? And then it's a good idea to make a call when the benefit year starts over again, whether that is January 1, which is what is most common, or if they run on what they call a non-calendar year. If it runs July to June, then on July 1st, they would want to call and make sure that since that benefit year is starting over again, has anything changed?
So it sounds like there's a lot of just legwork on the providers themselves, just making sure that nothing has changed. So at least every January or whatever the non-calendar year, and then minimum once a month, checking with families, making sure there hasn't been any change.
Right. Well, just when they go for a visit, you know, yeah, hey, has your insurance changed? No. Okay.
Okay.
Just asking that, you know, just asking, because a lot of time, you know, insurance, if they're not asking, we've run into a case where, oh, mom just let me know if the insurance changed 6 months ago. She forgot to tell me.
Okay.
Whereas if you're asking, then, you know, will spark in mom's mind, oh, I forgot. Yeah, we changed January 1 and you're there, you know, January 15th. Now you've got the information now instead of 6 months from now because you asked.
Okay. All right. Well, I just wanted to clarify that. I know that there were some folks that were thinking about that, and we've got some questions about reviewing out of benefit, but I think you're covering some of that later on, correct?
Well, yeah, in and out of network is just your choice. If you want to be in network, which opens you up to be available to plans that only have in network benefits, or that have both in and out of network benefits, or out of network, which means you can only see children that are not on plans with in-network only. And the choice to be in or out of network is entirely up to the provider because it does affect your reimbursement rates.
Okay. All right. Sorry to interrupt. I just wanted to make
sure. No, not at all. I would rather answer the question while it's kind of fresh in everybody's mind.
Okay. All right. Sorry, you can go forward now.
Okay. All right. Okay. So billable services, EI services that are billable to insurance. And these are ones that are going to affect a patient's family fee. AT, oral rehab, health and nursing, nutrition, OT, occupational therapy, speech therapy, vision, physical therapy, psych, and social work. They have to be billed to insurance, get an EOB, and then send that EOB and the claim onto CBO for processing. And we tried to come up with a pretty complete list. I don't know if there are any therapies that you guys can think of that we might be missing from this list.
Yeah, so I think if you can put in your chat box anything that you're missing. So looks like DT has been listed here, and DTVs.
Yep, because DT is not billable to insurance. So that one would, no, DT would not be billable because DT is not recognized by the insurance company. So DT hearing would not be.
All right. Let's see, I'm looking through the chat. It looks like didn't see any, what about interpretation? Is that one?
No.
Gotcha.
Nope, interpretation is not billable.
Okay. I'm looking to see if there's anybody, if anyone else had put anything else in. There's, okay, I don't see any other comments.
Okay. Okay, let's move on. Okay, not billable. There we go. Okay, so your assessments, audiological exams, deaf mentors, DT hearing, DT orientation, DT vision, evals, your IFSP development, interpretation, medical diagnostic and medical evaluation, parent liaison, service coordination, translation, and transportation. Those are all not billable services to insurance. So those would be billed directly to the CBO. Those are subject then to that 90-day timely filing. So it's 90 days from the date of service that these have to be billed to EI for them to be timely and considered payable by early intervention. Okay, and here's a little chart. And this is kind of just a flow chart of the billing process, like what you have to do as a provider, and then the process, whether you are going to bill it on your own to insurance and bill it to CBO, or if you choose to use the billing unit and then bill it to CBO. So starting with the gray boxes up there, you would call and verify the insurance benefits for that family, update the CFC if there's anything different than the information you were given by the CFC. Oh, hold on, threw me off. Okay, verify the benefits and coverage with the family. Let the CFC know if the information that you have is different than what the CFC has given you. Call and verify the benefits to make sure that you know exactly what is covered for exactly what is covered for that child's plan. That's okay. And then here's a little poll.
Sorry, I was hitting the
Nope.
screen. So let me throw
No,
that.
you're fine.
So far we've got, to check with the insurance and notify the CFC. And then this poll looks at how comfortable or how many of you have completed an actual benefit verification with an insurance company. So we'll see what your experience is in filling out a benefit verification. We do have a question break coming up soon, and so I have several questions that that we're going to talk about when we get to that break. I'm looking at some of them, and I know based on the presentation that you're going to cover some of these here in a little bit. So I may not address some of those questions right this second because I know you're going to cover them.
Okay, sure.
Let's see. All right, so I'm going to go ahead and post the results here for the poll. And so the folks that have had any experience with benefit verification, majority of them have never filled one out. And then there have been several that have filled out with, the CBO insurance verification. I think those probably would be the service coordinators.
Mm-hmm.
And then there are some that have lots and lots, lots and lots.
So they know the joy
Yes.
of benefit verification.
Yes. All right. I'll stop sharing that and we can go back to the slide.
Okay. I will say related to the benefit verification, there is a good video on the EI site related to like what questions to ask on a benefit verification, just as a kind of a follow-up and related to that if they, if someone should need some guidance on what questions to ask. There's a great video on the website for EI to go along with that. Sometimes that gets a little confusing.
We'll find that link and post it right out there for you.
Okay, perfect. Okay, so you call and do your benefit verification, find out exactly what is covered, how many visits, what their benefit year is, make sure they have in and out of network benefits. Double check if you need pre-cert. You're going to make sure that you want to check your pre-cert requirements for in the home and in the office because sometimes they're different. You get your benefit verification done, and then if you are not registered with the insurance company, you definitely need to get registered with the insurance company. And that is not putting you in network with them. It's not your in or out of network status. It is getting you into the system so that your claims can be processed. And once that is done, you can obtain any pre-certifications that might be required for the service that you are calling and getting those benefits on, which would be right here. Yes, not home health. A lot of times what we tell them over here is that the child is in early intervention and that you are required as a mandate of the program, which is a federal program, that you have to be in the child's natural environment and due to the child's age that is in the home. That's why we request benefits for both in the home and in the office. But sometimes if you can kind of clarify that, the child is not homebound, but you are required to go into the child's natural environment.
Thanks for that question, Meg.
Okay, so you get registered with the insurance company. You, as a provider, decide whether you want to be in or out of network. You get put into the system. That way you can do the billing, and you get your pre-certification. And then you wait for your approval, one, so that you're in the system so that your claiming will go through, and two, that you've got your pre-cert letter, because you don't want to end up in a situation where you have a claim denied for no pre-certification and that you don't have any kind of letter to show that you tried for pre-cert and it was denied, or you were told that you had pre-cert and you don't have a letter to back it up, because CBO will not pay for a denial of no pre-certification. So you want to have that letter, whether it's approving it or denying it, you want to have that letter in hand. So at that point, once you've got your letters, you're in the system, you've got your auth from EI, you can do your services. After you've done your services, you're ready for billing. So at this point, you decide whether you want to do billing yourself or you want to register with the billing unit and have them do your billing. The billing unit is a free service offered to individuals and small companies, which is 7 or fewer providers. And you do that by registering the provider first. All those forms are on the EI website. And then you would register the child. We would do our checks, make sure everything is okay, let you know when you were approved, let you know when the child's approved, and then you just fax in an encounter form to us. We create a form, submit it electronically. The payments come to you, the EOB comes to you, you fax us the EOB, and we do your CBO billing for you also. So essentially that encounter form is your insurance billing and your CBO billing. Or you can do the billing on your own to insurance. You would need to go out and buy that CMS 1500 form. It does have to be a certain shade of red ink. You can't print it. They are very particular about it. So you go and purchase your paper form, or you can get software or hire a billing person, and they can do the billing online, going through their software or going through a clearinghouse like Availity. And then that CMS 1500 form gets submitted to the insurance company, either electronically or on that paper form. It gets typed out and then mailed in. The explanation of benefits comes from the insurance. Some of them will mail them. A lot of them are moving away from that. So your best bet is to register online, particularly with like United Healthcare and HealthLink. Cigna, you can get over the phone. Aetna, you can get over the phone. Blue Cross requires you to register with Availity. So your best bet is any of them that you can sign up for an account on their website to get your EOB. It's by far your best way because you're going to get it a lot quicker. So you obtain your explanation of benefits, you get your EOB, and create a second claim that is in the format that EI requires it. It does not have to be on that CMS 1500. It can be on a plain white sheet of paper. You print it out, attach the EOB, and then mail that into CBO, and then that gets your claim processed through the CBO when you do billing. Hold on. So those are your two options to bill CBO. So now I'm going to give you just kind of a example. Going back to benefit verification, again, there's information on our website also. Questions if you're going to do, when you call to do your benefit verification. You want to know, is it a covered service? Are there any policy or place of service restrictions? Does it require a referral from the primary care physician? A lot of times if it's an HMO plan, it will require that, and it will only allow in-network providers. What are the pre-cert requirements? Again, like I said before, if you're going to want requirements for home and office, because a lot of times they're different. You want to find out who you contact to obtain pre-certification, because a lot of times they will have a different company do pre-cert. It's often not the insurance company itself, it's someone outside of them. You want to know if they have both in and out of network benefits. You want to know if there's an annual cap or a lifetime cap for the service. Say the plan has $1 million cap, or they do 60 visits per year, but it's combined with, it's PT, OT, and speech combined. You want to know what the benefit year is. Is it a calendar year, or does it run July to June? So you know what benefit year you're working with. Whoops. And then you want to know the claims mailing address, if you're going to mail your claims in, and the electronic payer ID if you're going to send it in electronically, because you're going to need to know where to direct it to. And then you're going to want to ask what the plan timely filing requirement is, because it can be, like I said, anything as short as 30 days or as long as a year. So it's important to know what that timely filing requirement is. All right. Okay, Maria, I'm ready to fire them questions at me.
Okay, so we have quite a few in here. So I'm just kind of looking through here. There was the question from C. Stangarone about EI paying down deductibles, and you kind of answered that in the chat, I believe, with the claim to deductible for EI services does help pay down. Can you explain that a little bit?
Yeah, so the insurance company, we don't collect deductibles. We don't collect that deductible amount from the family because it applies against their family fee. But on the insurance side, say they said, okay, this $200 deductible on this claim, we're not paying anything. So they're taking that $200 off of the family's deductible for the year, and EI is going to pay it. So the insurance company has said, okay, you've now essentially paid $200 of your deductible, and EI is going to pay it. So every $200 the insurance company has said applied to deductible is knocking that deductible down for the year, but the family's not having to pay anything except their family fee. Does that make sense?
I believe so.
It is taking every claim that the insurance company puts towards the deductible takes the deductible amount down, even though technically the family's not paying that amount.
Correct. So the insurance company doesn't care who's paying it. They just know they're not going to pay it.
Exactly. They are applying it towards the deductible. Whether the family pays it on the other end, EI pays it on the other end, my rich uncle pays it on the other end. Insurance doesn't care.
Okay.
They just know they are putting it towards the deductible, and as far as they're concerned, they didn't pay that $200, it went to the deductible. And then they didn't pay the second $200, it went to the deductible until the deductible's met, and then they will start paying.
Yeah. Okay. I think we can see from the chat. It looks like I don't see any other questions about clarification for that one. So
okay.
Meg had a question. We'll see. First, Aaron had a question about associate level providers. And Aaron, I think we filled Alyssa put in some information about who associate level providers are in the system. So hopefully that will be enough to cover that. That's probably a little beyond today's webinar. Meg asked, can you please review the out-of-network benefit again? So you talked about this, and I know you addressed Meg's question a little bit in person, but I know it's still a little confusing for folks. Like, I know that you have to be in-network. If you want to get in-network benefits, you've got to be part of that insurance company's network. But how does the out-of-network benefit work? Can you go over that more?
There are some plans that require the use of physicians or providers who are only in network with that plan. So if you are in network, you can see those kids and kids who have both in and out of network benefits. If you are out of network, you can see children that have those in and out of network benefits. But if that plan only has in-network benefits, you can't see any of those children. It's going to limit who you can see based on the plan specifications. If they are an in-network plan only, you as an out-of-network provider cannot see those kids.
Okay.
Does that make sense?
I believe so. Let's see if the chat says so. I haven't seen anybody respond to that question. So if that, hopefully that'll be enough. And then if there's more clarification needed, we'll see in the chat. Let's see. Jennifer has an interesting question here. Should a provider decline to take a kiddo on because they don't want the hassle of getting a pre-certification? It kind of goes beyond the CBO. That
is against EI rules, I believe.
Yes, it
to refuse.
Is. Yeah, you can't just, well, I guess the word would be cherry pick. Yeah, so you can't just pick the families that have insurance that you work with, or because the state.
And you wouldn't know that until after you accepted the child anyway, because you wouldn't know that until you get to the point where you're making a benefit verification.
Right. So that's probably a little bit bigger question, Jennifer, than what today's webinar is going to address. It really gets down to the provider agreement that you fill out when you agree to be a provider, and one of those things is that you agree to see all the families regardless of their payer. So okay, let's see. Kathleen wants to know, how do you bill an EOB to the CBO after you receive it from the insurance company?
You can use the free Q-Claims software that EI offers, and you would go in there and just create your claim in the system and print it out, and then you just attach that EOB to the claim and mail it in.
So it's done by mail? Okay. So I'm kind of going through, there's a lot of questions coming in. Let's see.
Fine.
Yeah. Aaron also asked, at the end of the day, if we're not correctly following this means we could not get paid for services that we already provided, correct? And that
depending on how the claim is denied, there is a chance that you may not get paid for services.
So the lesson there is to verify the benefits with the insurance company, get the pre-authorizations that you need. Yeah,
or if it's denied, make sure you have the letter showing it's denied. Because if you have if that EOB says no pre-cert, then you've got a letter saying, well, there's no pre-cert because it was denied. So there's your documentation. There was it's denied no pre-cert because they denied my pre-cert. So you have your documentation.
Gotcha. Okay. So what would be an instance where the insurance company would deny and then the CBO would say, sorry, you didn't, what would be an instance where they wouldn't pay either?
That one, say you didn't send it to insurance in a timely manner. If it was denied by insurance as not timely, CBO would not pay. If it was denied for no pre-certification by the insurance company and you didn't have a letter showing you tried for pre-cert, CBO would not pay. If they denied it for, and this goes back to the registration, if they denied it for, say, your NPI was not on file, or the NPI, you used to work for a company, now you're an individual, and you didn't register as an individual, but the NPI didn't match the tax ID, those are also not payable by the CBO. because that is a provider responsibility to get registered or get registered correctly for the way that they are billing. CBO wouldn't pay those. They would deny for if you were previously being paid for a service and then all of a sudden you get one that says it's not covered and there's been no insurance change. CBO would deny that as previously, they call it previously paid, not meaning that date of service was previously paid, but the service itself was previously being paid and then now all of a sudden it's not. That would be a denial by the CBO. Those are just ones that I can think of off the top of my head.
Okay, all right. Well, those give some good
So those are some examples
of things that, you know, and those are all really provider responsibilities. So if you follow the process of checking with the insurance company, checking benefits, getting pre-certifications, and following all the hoops that you have to jump through, those are all provider responsibilities.
Mm-hmm.
And then, okay. Now there was one question, there's a lot of questions that are coming through. And so I'm going to probably take a few of these for the next break. Cause I know some of these questions I think you're going to be addressing.
Okay.
But there is one question in here, and I think it's from Aaron, where the service coordinator is in all this process. So what the service coordinators do and the providers do kind of run parallel, but correct? So the service coordinators submit a benefit verification, but providers need to do their own.
Mm-hmm. The service coordinators just, they kind of, what they do is, yes, they submit the benefit verification, and then if there are specific providers that this child has to see, they get a list of those. It's their responsibility to make sure they're finding providers that meet the insurance requirements for this child's plan. If they can't find, say the child only has in-network benefits, if they can't find an in-network provider who can start services for the child in the required time frame, they should be applying for those waivers so that the provider can see the child. So they handle all of that kind of on the front end before the provider ever comes into the picture. The service coordinator is taking care of those responsibilities. More so what I'm focusing on is the provider part of it. The service coordinator pieces are kind of prior to this part of it, if that makes sense.
Yes. Yes, I think so. So the bottom line is that if you want to get paid for the services, you still have to do your own legwork.
Yes, there are, and DHS requires that, because we did initially talk about doing a lot of this stuff as the billing unit doing that, and it was decided that DHS still wanted providers to have some responsibility in the whole process.
Okay, all right. I'm looking ahead. I think there's one more question that I want to cover now before we move in. Let me see where are you going to be talking about waivers?
I'm trying to think. I think there's just a little brief part about waivers, but there is again, on the EI website, I think there's an entire video on waivers and exemptions.
Okay, so I'll find that link and we can post that on there as well.
Okay.
All right, well, why don't we go ahead and move forward? And folks, those of you who have put in questions, we'll catch it on the next break. And because I know there's some specific questions about the difference between self-funded groups and non-employer self-funded and tax saving plans. And so we'll cover those questions and some of the other ones on the next break. All right.
Oh, here, are the rates the same if you do your own bill? Hold on, I'm going to just address that one that just came up. The rate's the same if you do your own billing or CBO. Daniela, you choose your rates. Your hourly rate is your own, and what you bill to insurance has to be the same thing that you bill to the CBO. CBO will pay you the state rate, but your billing amount to the insurance company and to the CBO has to be the same, and you set that hourly rate.
And along with that question, I think it had, there were some other questions related to oh, where's it at here? Understand correctly that an independent provider can opt to use the EI billing service, and they do all of this for free. You guys do it all for free.
We do.
Yep, that was Eliza's question there. And then
We do it all for free.
all for free. And Daniela,
And I think we're pretty friendly. You know, I like us.
We do too. Along with Daniela's last question, she had asked about, are commercial insurances usually paying for EI?
Depending on the service, we have a pretty good reimbursement rate. We actually do the coding over here. That's why we require our providers to send in the evaluation and the script from the beginning and make sure that you have complete notes on the encounter form. We do the coding over here. And our average benefit to providers is right around $8,000 to $10,000 a week.
Okay.
So yeah, we have a pretty good reimbursement rate for our providers. So yeah, it's of course according to the plan. Some plans just, speech is just not covered, period, and we can't change that. But we do the best that we can with accurate coding. We have actually 2 certified coders. There's billing unit is 3 people, and 2 of them are certified coders.
That tells you how much is just making sure the coding is correct.
Right. Yeah, it's a very tiny unit, and I will say that, when you use the billing unit, if you want to talk to one of us, you can talk to one of us. It's not calling and waiting. We have a direct email for the billing unit, and if you need to talk to one of us, you can talk to one of us. You send us an email, hey, can you call me? Absolutely, no problem. I would rather you be comfortable knowing what's going on with your billing, or if you have a question, then be like, you know what, I don't want to use them. I can't ever get a hold of anybody. We don't want that. Mm-hmm. So, we try to be accessible to our providers.
Well, we appreciate that. So, all right, let's move on, and then we can come back to some of the other questions as later on. So, okay.
Okay, so I kind of went over some of this. I'm going to jump back into pre-certification. Before you start a service, again, it is vital that you contact them before you start the service, because you don't want to have done services and run into a case where your pre-cert starts after those dates, because then you're not going to get paid for any dates that are not covered by your pre-cert. So you contact that insurance company where you're going to be submitting the billing. Complete your registration requirements if you're not already enrolled, so that your claims can go through the system. Keeping in mind your registration requirements are different for each company. The amount of time required and the amount of paperwork required is vastly different between insurance companies. Some of them will require you to send in your W-9 form, and they put you in the system. Some of them, it's an entire application, and it will take 90 days. Blue Cross is one of those, that it's an entire application and it's 90 days. I think TRICARE is 90 days. I think Aetna is 90 days. I'm not positive about any of the other ones. United Healthcare used to just be a W-9 form, but I'm not sure if they've gotten away from that. So just be aware that it can be a lengthy process to get in there. Again, with what I said, registering with an insurance company is not the same as becoming in network. That just gets you into the system so your claims can be processed. Whoops, going the wrong way. Make sure that you are enrolled with the insurance companies prior to beginning to accept children. If you think you're going to start seeing Blue Cross children, go ahead and get registered with the insurance company. My advice would be get registered with Blue Cross, with United Healthcare, with Cigna, and with Aetna. Those are the major ones that we see. And if your paperwork is already in there and you're already in the system, then you are so far ahead of the game, because you don't then have to wait those 90 days or however long it is for that particular payer to get you put into the system. You're already in the system. We know that your claims will go through, and that's not in network or out of network, that is just in the system so that your claims will go through. The in or out of network status is up to you, and that will be something you will decide when you complete your paperwork to be put into the system. Darn it. And then once you have completed all of that, you're in the system, then you're ready to bill to these commercial payers. Once you know you're in the system, whether you're in or out of network, per your choosing, you're ready to bill to these commercial insurance payers. And a lot of them will send you an approval letter when you're done. Again, you should get an approval or denial letter for your pre-cert. If they don't send you one, call and request one, because you want to have your documentation. Okay. Kind of back to the actual insurance billing piece. It is a little confusing, and I kind of went over it a little quickly earlier. You have two options: billing yourself or billing through the insurance billing unit. As far as claims processing. So if you choose to do the direct billing, again, you'll need to get that CMS 1500, the red line claim form. You should be able to get those at pretty much any office store, or get billing software. The free QClaims version that EI offers will only allow you to bill to EI. It will not allow you to bill to the commercial payers. There is a version of it that you can get, but you do have to pay for that. Or you can get any other billing software, hire a billing person, they can do online submission, or again, you can buy the paper claims. So you would fill those out and submit it to the insurance company. You can mail those in, or if you're doing electronic submission, you would submit those online. You get your EOB, sign up on any websites that you can to access your EOB. That's the quickest way to get them. And then if you've not gotten paid by insurance, you've got your EOB and you can get it to the CBO quicker than waiting on it to be mailed. Insurance companies have 30 days to process your claims, and then time for the claim to complete the adjudication cycle and EOBs to be mailed to you. So it can be sometimes a 6-week process, sometimes even a little bit longer, depending on what their adjudication cycle is. So if you're registered on those websites and you can get your EOBs that way, by all means do so, because it's probably going to get you, if money's coming from the CBO on those claims, it's probably going to get you paid quicker. Once you've got your EOB, you get your CBO claim prepared. Again, it can be on just a plain white piece of paper. It does not have to be on that CMS 1500 form for early intervention. It does have to be typed. You would print that form out, attach your EOB to it, and mail that to the CBO. We do not currently do billing for CBO through QClaims if it has to have an EOB attached, and we do not accept that by fax. And then you would mail that into the CBO to be processed.
So it looks like we have another poll, and I know that a couple of folks had mentioned in the chat that they use a billing service. So I think we're kind of curious as to what, how you all actually do billing to insurance. Do you do your own billing? Do you utilize the CBO's billing insurance unit, insurance billing unit, an outside company, or maybe you just don't even know, your employer takes care of it all? I'm just kind of curious to see what are your experiences. And obviously we know some of the participants on today's webinar don't do any insurance billing whatsoever. So, but still it's good information to have when you're working with your peers and knowing kind of the things that they have to go through. All right, just waiting on a few more responses. Here's a quick question I think that we can answer. Melissa, is there a limit on how many clients you can bill through Availity?
No, the way Availity, at least the way we use it, we just do it claim by claim, and we've never had a problem with the number of children we've put through there, so I'm not aware of any kind of limit on Availity.
All right, here's our results. It looks like it's a mixed bag of everything. Looks like some folks have, do their own billing, but then some, they're not really certain their employer does it all. So, all right.
Ooh, I'm excited to see some that use our billing unit. Yay. Good choice.
All right.
Okay. Okay. So this is just going to go over, for those of you who may choose to use the actual CMS 1500, what boxes are required to be completed. Your claim forms have to be typed, both with insurance and with the CBO. You have to have your dates in chronological order, 6 lines per claim form. Make sure your place of service is correct. That means that it has to be where you actually did the service. Just because your authorization says home, if you were in the child's daycare, it needs to be daycare. Or if you were at the park, it needs to be 99. So 03 for daycare, 99 if it's the park. Those are all off-site, so they will still process through under your authorization that you were given. They just need to be accurate. So you shouldn't be billing home if you were not in the home. Make sure that you're using the accurate HCPC code. EI has a limited code set, meaning we only accept certain codes here. The insurance company does not. You should be billing insurance with the most accurate code for your service, and it may not be the same code that you're billing EI with. So if you are doing feeding instead of speech therapy, you should be billing the 92526 to the insurance company and then changing the code to the correct code for EI. Or if you're a PT and the code 97112 is more appropriate for insurance, that's what you should be billing with, and then you change it to the 97110 for EI. It has to be the most accurate code for insurance because they do not have the limited code set like EI does.
So just so I can clarify here that
sure.
Folks need to have a good handle on what is the most appropriate code to bill to the insurance company. It may not necessarily be the one that is on the, that is an EI one. There could be some other ones, but then when you go to balance bill to the central billing office, you have to use the EI approved code.
Exactly. Yeah, EI just has that limited code set. Insurance does not.
Okay.
Your total amount billed should be your hourly rate, not the EI rate, unless the EI rate happens to be your hourly rate. But you do have to bill the same amount to the insurance company that you bill to EI. So if your hourly rate is $200, you bill $200 to the insurance company and $200 to early intervention. The amounts have to be the same. Use an accurate number of units for your service when you bill it to insurance. For example, speech therapy, when you bill it to insurance, it's 1 unit because it's a 1 time per day service. But when you bill it to EI, you have to use the 4 units because EI recognizes all services as per 15 minutes. By the same token, PT and OT is 4 units to insurance because it is per 15 minutes, and then it's 4 units to EI. So you have to make sure that you understand billing number of units to insurance versus billing number of units to EI. Your rendering information goes in box 24J. That's you that's performing the service. Your billing information goes in box 33. Those may be different if you work for a company. So if those are different, that's fine. Here's that actual CMS form. This is what the CMS 1500 looks like. Those lines will be red. And these are the boxes that must be filled in. 1A will have your insured's ID number. It will be the actual insurance company ID number if you're sending to insurance. That will be the EI number if you're sending it to the central billing office. Box 2, patient's name in last name, first name format. Box 3 will have their date of birth. Box 4 is the insured's name. It will be the child's name if it's the EI, but it should be the name of the person that carries the insurance. If you're sending it to the insurance company, it's often not the child. It is the parent that is typically in there. Box 5 is the patient's address. Box 7 will be the insured's address. Oops. Box 11 is where you're going to find the group number for the insurance plan. Box 17 is where if you have the name of the referring provider and NPI, that's where that would go. Box 21 is where your diagnosis codes go. Box 1 is your date of service. It's 1 date of service per line. Place of service in box 1B. 1D is your procedure code, and then there's up to 4 blanks if you need to put modifiers on there. If you need the like GO or GP for PT or OT if you're billing it to Blue Cross, or you would use those same modifiers, GP for PT, GO for OT, GN for speech, if you're billing it to United Healthcare. Diagnosis pointers go here in box 1E to match up with however many codes you put here in 21. Charges is your total number of charges. Units, total number of units that you're billing. And then here, 24J is your rendering provider. So the provider that is doing the service, their name goes in 24J. And then the tax ID or social security number goes in box 25. So if you're an individual provider, that's going to be your social security number. Or if you're a company, it will be the tax ID for the company. Box 25 would have the patient's account number if you utilize an account number. 28 would be the total charge for the claim. So you would add up all the lines if there's more than 1 line on there. Box 31 would just be, we don't accept a signed copy, so it wouldn't actually be the signature. It would just be the typed name of the person whose name is in box 24J. And then box 33 is the billing provider information. And typically it will have the NPI and tax ID in boxes 33A and 33B. And just a couple of quick reminders. make sure you have notification or a letter from the insurance company that you are registered prior to submitting your claim. Otherwise, what they do is they will just sit out there or they'll reject. The CMS 1500 forms you will need to purchase if you're going to mail them in. Pardon me. You can find them at most office supply stores, or you can look into different electronic billing software options, or you can submit them online through some purchase software or a clearinghouse like Availity, or look into our free insurance billing unit service if you have a company where you're an individual, or have a company of 7 or fewer people. There's the link for the insurance billing unit. Time for more questions.
Sorry, I was talking in my mute button. So we do have questions here. And in fact, I was just trying to respond to a couple of them on text, but I think I'll just verbally say them. So Mary Beth and it looks like Valentine family have some questions about the rate. So you had mentioned that you should bill your own rate.
Right.
We try to explain that to folks when they're doing a system overview, and that your rate is not necessarily what the EI system or the Medicaid system or whoever system is going to pay you. It's the true cost of your service, correct?
Right.
And that you have to, as an individual, have to kind of determine that yourself, what your true costs are. There's not some people can go look and Google it and see what the ongoing rate is for a particular service, but really when you're figuring out your rate, it needs to be calculated on your business cost and materials, and that's how you figure out your rate. Am I correct in that?
Yes.
Okay.
Yes, it is. The rate is very individual to the provider.
Right. So so Mary Beth's question was, is there ever a time to change your billing rate? Whenever your billing rates change. So the answer would be yes. And as long as, it's my understanding that as long as providers bill the same rate to all clients, not a certain rate to those who have maybe private insurance or a different rate for Medicaid, or that it has to be consistent across all of the families, correct?
Right.
Okay. And then kind of along with that, Valentine family wanted to know, okay, if your hourly rate was different than the EI rate, who would pay the difference? And this is where the insurance billing comes in, correct?
Insurance will pay you what the plan allows. If they don't pay, you get the EI rate, and you have to accept either what insurance pays or what EI pays as your payment. There is no difference. There's no paying the difference between your hourly rate and what the EI rate is or what the insurance rate is.
Right. So when providers fill out the provider agreement, they agree to accept the state rate as payment. But if they bill insurance and the insurance pays 80% of I'm just going to throw a figure out there, $125 an hour fee, 80% of 125 is probably more than what the state rate is. Is that correct? And
that 80% is payment in full. That's it.
Right. Because it's above and beyond what the state would have paid. Okay.
Yes.
All right. Let's see. What if the insurance rate is less than the state rate? And that's where you balance bill, correct?
That's when you would bill. So you billed $200 to the insurance company. They paid $50 of it. You send your claim to the CBO, and CBO would pay the difference up to the state rate.
Okay, and that was Christina's question. So,
okay.
Let's see. I've been keeping track of some of these questions here. Sorry, I'm just kind of looking through here. If C. Stagnerone says, if I get a benefit verification back from the central billing office and it says they have PT 90 visits combined with speech therapy and occupational therapy. What do I need to watch for as a service coordinator? So this would be a service coordinator question. Does that make sense?
I'm not sure I understand the question.
If I get a benefit verification back from the central billing office and it says that the family has PT 90 visits combined with speech therapy and occupational therapy. So maybe she can, or this person can clarify that question again so that we can address it correctly. Let's see. Okay, here's a good one. Mary Beth wanted to know, if you want to have sessions in different environments, such as the park, do you talk to the service coordinator to have an auth for that, such as a park? So, because a lot of providers, they do, sometimes they provide the service in the home, but if it's a beautiful day out, they'll go meet the family in the park. They'll go do this. So, I mean, your auth wouldn't
No.
necessarily change, would it?
No, you can still, they are all what they consider off-site, which processes through here the same. So if you have a visit for home, your auth is for home, but you go to the park, you would bill it as 99, which is still off-site, and it will process through here under your place of service home authorization.
So if
they're kind of interchangeable on this end. So you just want to make sure you're billing it accurately. If you're at the park, you're going to bill it as 99.
Right. So if you're off though from on the IFSP says, see, is home 12?
Home is 12.
Home is 12. So if it says 12, but you actually provide the service in the park, you should bill 99.
Bill 99, and it will still process through.
Okay. Okay.
Same with place of service 3.
Got it. Okay. Hopefully that clears things up for folks. That was
essentially the only time you would have a problem is if your place of service is 11. If your auth is for the office, you can't go to the home or to the park. But if your place of service is home, you can go to the park, you can go to the daycare. Those are all kind of interchangeable. You just want to make sure you're accurately saying where you're at, because you don't want to bill it as the home, and then the monitoring group comes in and says, well, this says you're at the park. Why does the CBO have it as the home? You see what I'm saying?
Okay, so it really is, it's related to the on-site, off-site.
It is related to the on-site, off-site, not, you want to make sure you're billing it accurately.
I know that's really confusing for a lot of providers because
it is.
So many different changes. When you bill insurance and you turn around and bill the central billing office, some of the codes change.
But those place of service codes are the same for insurance as they are for
So
CBO.
Meg wants to know then,
those are the same.
Can you bill insurance the 99 as well?
Yeah.
Okay. All right.
We have had a very, very few plans. There's 1 or 2 that will question it, but yeah, you can bill 99 to insurance.
And a follow-up to this one then, Eliza has asked a couple of questions. Is your insurance, if you're billing the insurance company, does the location impact what the insurance reimbursement will be?
No, that is typically determined by the procedure code. The diagnosis code will determine if the service is covered or not, and then the procedure code has a set amount that is allowed on that particular plan.
Okay. All right. The questions just keep coming in here. So let's see. We've got about 7 minutes left. C. Stagnerone, I don't know if I'm saying that right. Sorry if I'm not. Clarified that question. She says on the CBO verification form that they got back, toward the bottom of the form under annual max dollar per sessions, it says PT 90 visits combined with speech therapy and occupational therapy. So
okay, so that's just how many visits they have per year.
Okay. And then once they've maxed that out, then insurance won't cover anymore.
Okay, so when CBO would receive notification of that, they would issue a max met waiver, but that would be done after the visits were maxed out and an EOB came in, letting CBO know that one or the other or both services were maxed out.
Okay. And that's probably a question when somebody has a question like that. That's really when they should just pick up the phone and call you guys, right? You know.
Yeah, and if the max visits are exceeded, if the EOB states max met, they will get a waiver for the max being met.
Okay, all right. Let's see. So Amy is mentioning that it makes her nervous to bill a code that doesn't match her off. Never heard that you could bill a code like that, and I know that makes everybody nervous too, because we're always like, no, you got to bill exactly what's on the authorization. So
yeah, and I understand that, but you want to be billing. You want to be accurate. You want to be billing the CBO with where you're actually doing the service. Being here in the insurance billing unit, I have to send back encounters that say, place of service home, and then the notes say saw child in daycare, because I can't send that note to the insurance company and say, I billed this with the home, and then send them a note that says the child was seen in the daycare, because they're going to go, what? That's not right.
So in that situation, they would just bill a 99.
No, they would bill a 3. Place of service, 3 is daycare.
Daycare, okay, I'm sorry.
Yeah. So we want to make sure that it's accurate. Mm-hmm. Just like we're going to bill it to this, we're going to bill it to the CBO that way. And CBO is going to go, okay, 3, yeah, that's an off-site code. They have an off-site auth for place of service 12. Yeah, that's fine. System's going to process it.
Gotcha. Okay. I suspect that you're probably going to be getting some more calls after today's webinar.
That's fine. Absolutely. Absolutely. I mean, insurance is so confusing, and I understand that.
Mm-hmm. Okay. It's actually, that's good for us as trainers to know as well, when we're doing system overview and service coordination training and things like that, to be able to. And
if as a provider you are more comfortable requesting a second authorization and your service coordinator is willing to do that, you are more than welcome to do that. I understand, covering yourself. Absolutely. If that is where your comfort zone is at, do that.
So
12 for a child. I do not bill insurance first. Okay, if you're not billing insurance, I just saw a question come up, sorry.
No, that's fine.
Can I do the 3 or 99 code if it changes? You would bill it wherever you do the service at, regardless of whether you're billing insurance or CBO, even if it's different each week. That was Meg's question to me. I just happened to see it pop up.
Yeah, so as long as your original authorization is an offsite code, mm-hmm. you would bill the appropriate offsite code depending on where you were providing service.
Mm-hmm. Right.
Okay.
Even if it's different each week. Because like you said, I understand that they will. Sometimes they're at home, sometimes they're at the park if it's nice out. Mm-hmm. We have a provider that does services at the pool sometimes. So we use 99 for that one.
Right. I'm trying to decide, we've got 2 minutes left. Do you want to just go to the slide about the benefits of using the billing unit, and then we can wrap up? And
sure. Let's, some of it we may have covered already.
Yeah, I believe so. So
yeah, that was the claim. Completing the claim.
And there's the link for submitting a claim.
Yeah, for sending it to the CBO. Here's the insurance. Okay, so the benefit of using our unit, it is entirely free if you're credentialed with EI. We help to maximize insurance payments to our providers. It saves time for you because you submit that encounter form, and then we bill to insurance and bill it to CBO for you. We have certified coders with knowledge of federal laws for billing. You have access to speak directly to our staff with questions and issues. And again, we do your commercial billing and your CBO billing. So that is a help to you guys. The registration forms for both providers and for the children is on the website, on the insurance billing unit page to register with us. The encounter form is also on there. It does have to be typed. And then we take care of the rest, except for the CBO, the EOB, and that is because often the check requires that, and we want that to come directly to you. We don't get involved with the money part of it. You've earned the money, so we want to make sure that you guys get the money. Couple things to remember: make sure you bill the CBO within 90 days of the date of service or the most recent communication for them to be timely. That is all claims, not just the ones that you're expecting payment on. That is every single claim has to be billed to the CBO so they can track your service. Make sure you have to accept insurance payment or CBO payment as payment in full. Verify your insurance and double check the status with your visits for the family. CBO is responsible for paying the claims that are applied to deductibles and copays. And yes, again, you must bill for all EI services, even if you were paid at or above the state rate for the insurance company. It's a requirement of your EI and provider contract. Those all have to go to the CBO so that they can be tracked on your authorization that is in our system to show the child is getting the services. Okay.
Okay, it is actually. We did. So I want to thank you, Destiny, for kind of open up this can of worms on insurance billing. There's just, and you did warn us in the beginning that you could spend all day talking about this. So
yeah.
So there's just so much out there. We tried to address everyone's questions, and I hope we got most of them. We've got a list of the questions that have come in, and that we'll forward on to Destiny that she can answer, and then we'll forward those on to registered participants in an email. So that way we can kind of cover all of that. I am also want to thank everyone for participating. Remember, you're going to get an email and fill out that survey, and you'll get your certificate. Join us next week for the webinar on inclusion and Virtua 3. What does it mean? That is on February 26th at 10. Destiny, thank you so much. Sure. Do you have any last minute comments you want to make before we close?
I just want to say thank you, everyone, for taking time out of your busy schedule to be here and listen to me. And please feel free to reach out with questions, concerns, feedback. This was my first time, so I appreciate everyone being willing to sit here and listen. And yeah, if anyone has anything that they would like to say, please feel free to reach out. I would love to have the feedback.
Awesome. Thanks a lot, Destiny. So folks, the webinar's over. Look, we're already having folks asking for part 2s. So.
Oh no. Maybe I need to take my show on the road.
Yep. All right. Well, thanks everyone. Have a great rest of your day. And if you're in some place where it's sunny, enjoy it, because I don't think it's going to stay. Have a great day.
All right. Thanks.